Home delivery. Home delivery, this is an attended or an unattended childbirth in a non-clinical setting, typically using the neonatal childbirth method that takes place in a residence rather than in a hospital or a birth center, and usually attended by the midwife or lay attendant with expertise in managing the home birth. Here we can look for the types of home births. The first one is attended birth. They are assisted through labor and birth by a professional, usually a midwife and rarely a general practitioner. While speaking about the unattended birth, the unattended birth can be said as attended by a layperson, perhaps their spouse, family, friend, or a non-professional birth attendant, sometimes called a free birth. Here we can look for the contraindications of the home delivery. The first one is high-risk maternal condition, abnormal obstetrical history, cephalopelvic disproportion, preeclampsia, antepartum hemorrhage, previous cesarean section, postpartum hemorrhage, forceps delivery, placenta accreta, polyhydramnios, elderly primipara multiple pregnancy. And the second one is abnormal medical history. The people may have the cardiac disease, tuberculosis, diabetes mellitus, severe anemia, and sexually transmitted diseases. Contraindications of the home delivery. Another one is the fetal condition. The history of a repeated abortion or the stillbirth is mainly taken place here. Neonatal death or no living child, breech presentation or any abnormal presentation, less than 34 weeks of gestation, RH incompatibility, and the fetal monocytosis. Home conditions. The presence of infectious disease, overcrowding, destitution or poverty, unsanitary conditions. Advantages of the home delivery over the hospital delivery. Emotional support offered by the husband and the family is more readily available than in the hospitals. There is less danger of infection, no nosocomial that may cause a complication for the infant and the mother. It is less expensive than in a hospital. While speaking about the disadvantage of the home delivery over the hospital delivery, home delivery is for low risk pregnancy. No service are available for the high risk pregnancy or the neonates. They also have the lack of facilities or the sophisticated equipment, lack of trained personnel except the childbirth attendant. These are all the major disadvantages of the home delivery over the hospital delivery. Here we can look for the home delivery utensils. One of the rooms in the house with privacy and light is utilized as a delivery room. In place of delivery table, an ordinary bed or the papak is utilized. For linen, the ordinary sheets, blankets, clean pieces of cloth and the baby's laid are used. For dressing, OS cord dressing is prepared before the hand. For sterilization, the following are used. The one is boiling, ironing, carbolization, flame and sunshine. Large pressure cooker with the capacity of 2 gallons can be used as an autoclave to sterilize the OS packs, rubber gloves and linens during the delivery at 15 laps pressure for 15 minutes. Here we can look for the mother's preparation for delivery. She should create a space. Pile up clean sheets and towels should be used here. Know your backup hospital and affix the telephone number to your refrigerator for easy access. Prepare a transport facility in case of emergency. Mother should be instructed regarding the breathing and relaxation techniques during the labor. The most important is the observance and the maintenance of the cleanliness to avoid the infection. Here we can look for the delivery kit. Soap dish with soap or scrubbing solution, hand brush, clean or boiled water, hand towel or apron, newspapers or plastics for improvised killy pad, and the sterile water, packed sterile cotton balls, bottles of povidone, iodine and the alcohol, bowl for cotton, soaked in the antiseptic solution, sterile urethral catheter, 2 packed sterile gloves, sterile plastic lining for instrument and the syringes. Delivery kit. The delivery kit we used here is mayo scissors, rubber suction bulb, 2 clamps for the cord, sterile gauze, flashlight, stethoscope, sphygmomanometer, notebook and pencil, disposable plastic bags, amber bag, weighing scale, bowl for baby, gauze for wiping baby, and 70% of ethyl alcohol. Here we can say the general principles in the management of normal delivery. The initial examination of the birth attendant, general physical examination of the head, neck, chest, and the abdomen. Here we can look for the vital signs like blood pressure, PR, pulse rate, and the respiratory rate, auscultation of the heart and lungs, measurement of the funding height, Leopold's maneuver for position of the fetus, and full minute count of the fetal beat. The initial internal examination is done after cleansing the vulva with soap and water, noting the membranes, presentation and the station, or any abnormality. A patograph or a labor curve sheet is prepared for use to detect an early abnormal patent labor. Now we can go for the first stage. Regular, frequent, careful observation of the VS, FHT, progress of labor, signs of impending, second stage nursing care. Careful observation of the uterine contraction, careful observation of the maternal pulse. Rates higher than 90 per minute may indicate dehydration due to the prolonged labor, heart failure, and anemia. You can also note the careful observation of the FH or and the prevention of infection is noted here. Reduce the fear and anxiety. See that the bladder is emptied. And you can also go for the second stage. The following preparation should be done here is cleanse the vulva with the betadine cleanser and followed with a betadine antiseptic. Scrub hands and wear the sterile gloves. Patient is already in a semi-forward or dorsal lithotomy position. Set up an equipment for including the rubber sheet. When the bowel is ruptured and the cervix is at the full dilation, advise the mother to bear down during the contraction. Next, we can go for the delivering the baby between the contractions to avoid the laceration. Protect the perineum as the head crowns as the patient to breathe through her mouth and not to push. Allow slow extension for the head between the contraction. Grasp the head on the either side between the extended fingers and palms of the hand. Feel around the neck to determine if there is a cord coil. As the head retrudes or rotates, give the steady, gentle downward pressure to allow the anterior shoulder to go under the symphysis. Shift your hold from head to the body and deliver the trunk and legs. Hold the baby in one hand. If the pulsation of the cord ceases, clamp the cord with 2 clamps. Stimulate the baby to cry. Keep the baby warm and covered. And we can go further. Third stage, observe the Calkin sign. Observe for the lengthening of the cord. Do not interfere or force the delivery of the placenta. Placenta may be delivered in 2 ways. One is modified Credis maneuver and another one is a branded Andrews maneuver. Examine the placenta carefully after the delivery. Place the placenta in the placental basin. Check for laceration. Oxytocins are given to prevent the further blood loss. Check for the mother's temperature and also the vaginal fetal temperature. Immediate postpartum care. Monitor the 4th stage of labor. Ascertain the sex and the condition of the baby. Observe the patient's general condition. Take BP every 15 minutes. Check the pulse regularly. Observe the amount of bleeding. Palpate the uterus frequently. Watch the bladder closely. If the patient cannot urinate after 6 hours, catheterize the patient aseptically. Check the vulvar region for the hematoma formation. Record VS. If the uterus is not well contracted, gently massage the uterus to promote the contraction. Newborn care. Wash hands preparately to giving the care. Place baby on the footpath of the mother's mat near the equipment area. Immediately after birth, wipe eyelids and apply the terramycin ophthalmic ointment to each eye. A square knot is used to tie the cord 1 cm above the tie and wipe the string with alcohol. Apply cord dressing. Put on triangular binder. Wipe off the blood on head and face if any. Spread where next caseosa using the OS. Inspect the fontanelles, head, eyes, ear, nose, mouth, anus and entire body. Measure the baby from the top of the head to the bottom of the heel. Weigh the baby and measure the crown heel height. Dress the baby. Put the baby to breast as soon as the mother is comfortable. Care during the puerperium. Purpose of the postpartum care: to ascertain the condition of the mother and the baby and give the nursing care if indicated. Teach the family the importance of cleanliness and to demonstrate the usual care of mother and baby. Postpartum policies. Patients are encouraged to move frequently soon after the delivery as they are able to do so. Diet rich in the fruits, vegetables, and meat. For pain, use the analgesics. Daily routine checkup. Check for the temperature, pulse, respiration, blood pressure, lodging, perineal, consistency and height of the fundus. Bladder. Breast clean with the soap and water. Fissures are best treated as follows. Suspended breastfeeding. Apply the antiseptic ointment every 3 to 4 hours. Keep fissures dry using the heat lamp for 20 minutes per 4 hours. Recording and reporting. It is filled up right after the delivery. The responsibility to register rests on the physician, nurse, midwife, or even the parent of the newborn. Registration is done at the local civil registrar. The certificate should be accurately and completely filled up. Thank you.